Hey everyone, welcome back to another episode of the Brawn Body Health and Fitness Podcast. I'm your host, Dan Brawn, Doctor of Physical Therapy, Certified Personal Trainer, and overall health and fitness fanatic. I started this podcast over 2 years ago to bring you the top health and fitness advice, and every week I interview new guests and new people to help bring all new insight and information your way. Today, I'm talking with Dr. Scott Dickenson from Neckslevel about neck pain and cervical spine problems and what his new Neckslevel device offers. Before we get to this episode, here's a quick word from one of our sponsors. This episode is brought to you by CTM Band and CTM Recovery Products. These are the exact soft tissue recovery tools that I'm using on myself and with my patients day in and day out. CTM Band was founded by Dr. Kyle Bowling, a sports medicine practitioner who treats professional athletes, and he was a former guest on the Brawn Body Health and Fitness Podcast. You can check out his website at the link below and use the coupon code BRAWN10 to save 10% off your order from CTM Band. Scott, welcome to the podcast. Really excited to have you on today, man.
Thank you for having me, Dan. This is a pleasure.
For people who aren't familiar with you or your company, Neckslevel, and all the amazing things that you guys have been doing, would you mind kind of filling us in a little bit about your backstory and who you are?
Yeah, so my backstory, I'm an athletic training student at a Pitt. I did athletic training, graduated out of there in 2016, and then I went to University of Southern California for physical therapy school and graduated there in 2019. From there, I came back to the East Coast and did a residency at the University of Delaware in orthopedics. And I graduated mid-pandemic in June 2020. And ever since then, I've been working in an outpatient clinic, Excel Physical Therapy, in Chalfont, Pennsylvania, which is a suburb of Philadelphia. And all the while, I've been working on this company, Neckslevel, which you referenced. And Neckslevel is based around an invention of mine, which is a neck rehab tool. As a physical therapist and even as a student coming up, I was sort of surprised by the available or lack thereof neck exercises that we have our patients do for neck rehab. They seemed embarrassing to patients, uncomfortable, and perhaps ineffective. And I thought there was an opportunity to invent a product that filled this gap. And so far, so good. It's been on the market for about 11 months, and I'm still treating 20 hours a week. I'm an orthopedic residency mentor, which I really enjoy. So I have my hands dipped in a couple different buckets within the PT world and the business world. And similar to how we were just talking about before we started airing, I've just learned so much in the process of, one, going into the medical profession, but then two, jumping into the business world and, trying to make a profit. So all that together has made for someone who's learned a lot in a couple of years.
Yeah, definitely. You've got an incredible journey and so many amazing experiences, Scott. And I think you hit the nail on the head that, when it comes to the neck, it is so essential that the muscles surrounding it are strong to help prevent so many different types of disorders like concussions, right? Neck strength is huge in relation to concussions, but we're very limited in our options for treating the neck and increasing neck strength and that sort of thing. You mentioned that Neckslevel is kind of your new invention and your attempt to kind of increase our intervention realm in the realm of the neck and the cervical spine. So for people who haven't seen the product or your website or that sort of thing, would you mind just describing a little bit about it?
Of course, yeah. It's a low friction sliding platform where you can add resistance or take away resistance. So the user would lie down on their back or in prone, and they would move their head in different directions, and this would apply resistance to the platform. And it's a really simple device. I'm a simple guy. The thing just slides back and forth. But it's surprising how many exercises you can get out of that simple little tool. And then when you add different resistance levels, the option to take off all resistance and just work on range of motion, it's been really cool to see, how all the clinicians across the country have been playing around with it. They'll send me videos and pictures and have you used it like this, et cetera. And then I get to toy around with it too in my clinical practice. So it's very interesting. It's been on the market for, like I said, only 11 months. And I think it's going to be really interesting to see how it continues to grow with just such a simple tool. Like, how many different ways can you use this product?
Definitely. That's incredible. And I love the use of the resistance bands for the resistance, because that's going to kind of match the force curve that our muscles naturally have, right? The more we contract, the stronger and stronger and stronger it gets, right? When we look at something like a bicep curl, our weakest point, or the point we're not as strong, is going to be the bottom part. So that resistance band matches the natural force curvature that our muscles kind of have programmed within them. So I love that you're using the bands for it instead of just the weight plates, because we can add weight to anything, but that doesn't change in relation to how our body is meant to move and how our muscles are meant to work.
Yeah, for sure. I concur, and I always start to I always start with no resistance at all, and I think there's something to be said too for motor control in our setting. If we're just talking about from a rehab point of view, where there's pain involved, yes, like I think it's good to perhaps add strength, but say I'm treating low back pain or neck pain for that matter. Am I really strengthening the muscles? Like, are they actually stronger pound for pound for what kind of force output they can do? I don't know, not sure, perhaps, but I think that the base level of that is improving their motor control, getting the muscles firing in the right fashion. In the cervical spine, I think a lot about the deep cervical stabilizers, like the deep neck flexors, the multifidi, et cetera. And so I like to think that the low resistance on the next level can activate those little guys and then set up the big guys to shine down the road. So that's how I think about it. Who knows if I'm right?
That's a point that I feel very strongly about as well. Is you look at most outpatient PT practices that see a patient 1 or 2 times a week for 6 to 8 weeks on average. Is that really enough time to cause muscle hypertrophy to lead to strength gains? Personally, I don't think so. So I completely agree that there's something more to be said about the motor control model. And that ties into, in a way, almost all physical therapy being related to neuro PT, right? We're doing a lot of neuro rewiring and hardware rewiring, and not necessarily bulking up a muscle as you would in the gym. Now, there's times when we would bulk something up, right? If I've got a patient who's post-op ACL repair, and we're 2-3 months out, yeah, I want them to get their quad strength back and their quad size back. So I completely agree with everything you were mentioning. When it comes to neck training in general, if someone has weakness in their neck or dysfunction of their postural stabilizers, what could that set them up for as far as like different diagnoses and conditions that can develop from weakness and some of this imbalance that we've talked about?
Yeah, so I think of it as, the deep, small muscles in whatever way have stopped doing their job. I like to, now that I started jujitsu a few months ago, and I can feel this repeating in my own neck, like on a weekly cycle. I'll undergo some sort of neck crank where, they'll crank my neck around, forcing me to tap out submission, and I'll have pain the next day. Perhaps a facet joint will be irritated. And what I feel is that my neck is instantly weaker. But was there actually any strength change in overnight? Of course not. There's something to do with the activation patterns. Perhaps those deep stabilizers, which we know at least in low back pain, when there is an injury, those deep stabilizers aren't firing or working in the same manner. So that's why we think dead bugs and bird dogs are so helpful, because they kick on those deep stabilizers and set up the rest of the spine to perform better. So I feel it on a weekly cycle. My neck gets weaker after a little injury, like a facet syndrome or something. I think that those little deep neck flexors have turned off. And then it's my job and our job as physical therapists to get those little guys working again. And that also is where manual therapy can come in, where we might do a click manipulation, activate those guys as well, start to train them with little exercises, and then slowly build out the program from there. So what kind of injuries can you expect from someone who starts to see these patterns unfold? It turns into a chronic scenario, right? So if the deep stabilizers aren't effectively working for you, it's a problem that's going to keep recurring. So if you're sitting at your desk for, untold hours per day, and every month or so you turn your neck and have a little spasm or something goes wrong, then it's likely that you haven't built up the proper system within your neuromuscular chain to allow for the neck to function normally, and it just keeps getting set off. So that's why the patients can get frustrated when the problem keeps coming back, is that perhaps the underlying issue hasn't been addressed. And I think for the cervical spine, a lot of that comes back to the musculature.
I love your analogy of looking at the neck kind of similarly to how we look at the core. The lumbar spine and the cervical spine are related in a lot of ways, right? Both of them tend to be areas where we see a decent amount of mobility, right? The thoracic spine tends to be our area that gets tight and stiff on people from postural dysfunction, and thoracic problems end up leading to that classic forward head posture, the upper cross syndrome, all that sort of thing. So when we think about that, the cervical spine and the lumbar spine have some things in common, and adding more stability tends to help, as you mentioned. So I love that comparison and love that analogy. And the thing is, there's so many different ways to do that, right? Say you start with something like your Neckslevel device. Like you mentioned before, you could start unloaded, no resistance to that, and just get the patient to focus on feeling those muscles work again. You could probably pair that with biofeedback, right? You can take that blood pressure cuff that no one in the clinic ever uses, and you could put it under the neck and inflate it to a certain pressure and have the patient work on that deep cervical flexor activation, right? And have them hit different numbers or hold it at different numbers for different lengths of time. So I love that comparison and love the possibilities that, training the neck, kind of like the core, opens up. And I also love that you hit on the fact that neck pain can become chronic. And maybe it does have a diagnosis to it, right? Maybe it's something like cervicogenic headaches related to postural dysfunction, right? A lot of people don't understand that headaches can be traced back to your neck and your overall neck posture, neck musculature. And a lot of people, at least that I've talked to, they get headaches almost weekly. And they don't realize, hey, I could actually do something about this. I could get this better. I could get this taken care of. But if it's not taken care of, it does become chronic. And we know that anyone in pain for months on end or years on end, even, it sets them up for decreased quality of life, because no one's happy when things hurt, let alone when they've hurt for years and years and years. And if it's been years and years since something has started to become problematic, I'll say, it's probably going to be a lot harder to fix it than if you just went out and got it addressed early on.
I concur. And what's the way you're talking about the neck and the lumbar spine being relatively mobile compared to the thoracic spine, it's just one, it's beautifully put. And I like to think about anatomy with the thoracic spine being surrounded by the rib cage. Mm-hmm. There's a lot more bony blockage to motion, and so it's natural that there's going to be less mobility in that area. And so rotation, flexion, extension, they're all very limited throughout the thorax. But then you look at the cervical spine and all that stuff is gone. The limitations are very minimal. It's just the bony limitations of the facet joint orientation. And then you look at C1, C2, and it is responsible for half of the cervical rotation. So there's so much motion coming out of the neck. And so, when I think back to some of my mentors, thoracic spine is like the golden region for improving neck mobility. And it's like, wait, what? Like the thoracic spine for neck mobility? It's like, yes. Mobilize the thoracic spine and you'll see improvements in cervical range of motion, definitely improvements in neck pain. Like I said, I'm a residency mentor. And that's the first thing. Like if there's one thing I can teach somebody that has been bestowed upon me, is that if you're treating neck pain, you don't often have to use your hands on the cervical spine. Manipulations for the thoracic spine, mobilizations, mobility exercises for the thoracic spine go a really long way in helping someone with neck pain. And so that's easy for patients to do from home as well. A simple foam roller or a chair with a back on it. There's a lot you can do there. And so thoracic spine, super stiff. And then like you said, the cervical spine is so mobile. So that requires a lot of responsibility for the musculature to stabilize. So, all the emphasis in my brain is that, we have to fix any like range of motion limitations. But a lot of times that comes from strengthening or activating the deep musculature. And they'll see range of motion improvements within session just from exercise, like muscular activation exercise. And they'll see range of motion improvements. It's kind of counterintuitive, but this is because there isn't any actual blockade to the system, right? This is a very mobile unit. It's just that the muscles aren't firing in the proper way, usually as a result of injury.
Right, right. And if you are going to go manual for the cervical spine, this is an area that I personally value the muscle energy techniques a lot more, because you can start to activate or inhibit some of those specific muscles that attach to the neck or the skull and play an important role in your overall motion of your head and neck, right? I think sternocleidomastoid comes to mind for me first off, because you see some of these people walking around where the muscles just bulging out even, and that's one that we tend to see tightness in and tend to want to inhibit. And you can do the same thing with other muscles like the upper trap. I know we talk about upper trap as a shoulder muscle, but people forget, as you mentioned, the anatomy. It originates on the external occipital protuberance, I'll say like medial half of your superior nuchal line, and your ligamentum nuchae. So basically C1 to C7 spinous process is the ligament off of it. And the fact that it connects the neck to the shoulder opens up that whole world of regional interdependence that we started to hit on just a second ago there, where everything thoracic, cervical, shoulder, it's all kind of connected in one way or another, as you mentioned, right? You improve stuff at the thoracic cage, and all of a sudden the neck motion gets better, the neck pain gets better. And to some people that's baffling, right? Because if something hurts, they go right to the site of pain. But to other people, they realize like, hey, there's a lot of interconnections here. There's a lot of things going on. And if I just look at that one piece, I might be missing something else, right? Going back to your example with the thoracic cage, a lot of muscles from the neck are attached to your ribs and other areas in your thoracic spine and help you with breathing. And I forget the exact number right off. We mentioned this in a podcast with Dr. Brian Larish a few weeks ago. A whole host of people struggle with proper breathing patterns and proper rib movement with breathing. So if people are struggling just to breathe correctly, and a lot of the muscles that help us with respiration attached to the neck, what do we think is going on? There has to be some kind of connection there, and we have to be willing to explore that a little bit more. And I know that's not necessarily the type of thing that's covered in every physical therapy program or every AT program, but it's important to look bigger picture, right? Start 30,000 foot overview and then start to narrow in on the specific site from there.
For sure. I remember when I was in PT school, I was still dealing with some neck pain, and I was getting familiar with the work of Dr. Deborah Falla. She's from the UK, and she studies the deep neck flexors, and she'll do a fine wire EMG, and she's out of the Gwendolyn Joel lineage, and so she'll do a lot on muscular activation for the cervical spine. She'll treat neck pain almost exclusively with attending to the deep neck flexors. And so I just started to see how little I could do to help my neck pain. And I would lie down and just do chin tucks with my head up on a little towel, clear a little bit of space for my neck. And I would start to think about how I could feel the deep neck flexors working or not working. And I noticed that it really depended on the position of my thorax, right? So if I was lying on my back supine with my legs flat, I could not feel the same level of activation. I couldn't feel that little burn deep behind my throat as if I was in like a dead bug position, or what I ended up doing was just putting my feet up on my bed and lying on the floor. For in some way, aligning the thoracic spine, putting the spine in neutral in general, really helped me to activate my cervical spine, the deep neck flexors. And so I've kind of taken that into consideration as I do exercises on the Neckslevel, where it's far better for muscle activation in the cervical spine to get a posterior pelvic tilt in the lumbar spine, get the rib cage unflared, right? So if you think of flared as the ribs up, and you can see the ribs dissociating from where the stomach begins, if you can flatten all that out, the activation in your neck goes out of the roof for me. It's amazing. And so it like you said, there's a lot of regional interdependence. There's a lot of muscles that go between the neck and the thorax, and I just love to feel it all, because there is a different feel to it depending on the position of your spine.
And I love that you're willing to play around with the positions to find what works best, right? Because I feel like a lot of people just give exercises without ever trying them themselves. And you find these little tweaks, like you mentioned, that allow you to feel it more and feel what you want more. And to me, that's a true master, right? Not someone who can just give things out, but someone who actually understands the underlying principles and the knowledge and how to modify it in order to fit the person in front of you. Because like we mentioned before, a lot of this is neuro, a lot of it is mind muscle connection related. So if your goal is to get someone to feel it in a certain muscle group and they don't, then are you really doing what you intended, right? So that's part one. And part two, I love that you're able to kind of adjust in these different positions in order to open up new realms of training, right? So you mentioned that you'd like to go into that flat thoracic spine, posterior tilt, dead bug type position there. Well, why not chin tuck and then go to a dead bug and hit that cervical component and the lumbar component at the same time, right? Two birds with one stone. A lot of patients, if they've been in pain for a long time and it's neck pain or lower back pain or whatever, a lot of patients have more than one thing going on, at least from what I've seen in my own experience, right? You know, their lower back hurts, but their neck hurts too. And maybe the script only says lower back pain, but if you're going to give them dead bugs for lower back pain and they're complaining about their neck, why not just make them do a chin tuck in that position too, right? You're still achieving your overall goal of treating lower back pain, but you're going a step further, a step beyond, and you're now helping the patient with their neck pain as well. A lot of other diagnoses come to mind outside of the postural world and the regional interdependence too, for the, I'll say, use of a variable resistance neck training device. And I mentioned before concussions. Neck strength and neck stability is one of the key factors to help us prevent or reduce the severity of concussions, right? So if we look at athletes like football players, I believe you actually just worked with a football team recently, if I remember correctly, strengthening those neck muscles and making sure that they have good control of their head and neck in all positions is important and might help them prevent that serious injury that we're seeing too much about in the news and, you know, the movie and all that sort of thing. So would you mind sharing a little bit about your work that you've done with football players and all that sort of thing recently?
Yeah, of course. It's been pretty remarkable. I've been very lucky, and a lot of this leads back to athletic training and the connections I had just coming through as an undergrad student. But I've been put in touch and now working with a couple NFL teams, a couple high-level collegiate teams, and then like a few individual NFL players. That's just for football. So what's been really interesting to me is when I was putting the Neckslevel into some NFL athletic training rooms, I thought they were going to ask for more resistance. It was, as TheraBand, yellow through blue, yellow, red, green, blue. We're all familiar with that resistance level. And these behemoths I thought would power right through blue right out of the jump. But what was really interesting was, they had the device. I let them trial it for a month to see what they thought and see if it was something they'd want to implement for their season. And this was going into the prior season, 2021, 2022 season. And so I've since recapped with several of the teams, and they use it after neck injury, after stingers, after concussions, but they're only going through yellow and red resistance level. And I was really surprised by this. I was like, well, why? And they're like, well, we're not trying to turn on everything. We're just trying to get those little deep muscles. So, it's the same kind of logic I was trying to get at before, where they're just trying to get the small muscles, and they know that they can overdo it if they increase the resistance. And yes, these guys could probably power through blue, no problem. And then I have black and gray, which are, additional bands that you can get. But so I've learned from NFL teams that they're not specifically interested in, maximal neck strengthening and max training. Like, sure, they might have other devices in the weight training room for strength and conditioning, but in their rehab process, they're looking for light and simple, and they're looking for something that's gentle and perhaps a little more pain-free than other options in the past. So that's been interesting to see. And then some, I've worked with an NFL player who had a history of stingers. And so we started to, same story. We started to work on the deep stabilizers of the neck with the Neckslevel. And we were just texting the other day. He actually referred me to another tight end on his team. And so they've just found results from doing the obvious stuff, training the small muscles within the neck, but it's stuff that they hadn't been doing before because, this player, he's a large guy. And he said that, they had been doing the neck with weight where there's actually like a machine where you're pushing into it and you can load up 45, 90 pounds, no problem. And he says it doesn't feel right. You're just blowing past everything that you want to hit. And so sure, the muscle is going to get stronger, perhaps isometrically in that manner, but are we missing the little muscles that we're going for? That's the thought process. And it seems like it's been working for him. Again, that's a small case study. But additionally, we're working with the University of Delaware. They're looking at the Neckslevel as a way to strengthen the neck for concussion reduction in their female collegiate soccer players. So that's ongoing now. We're just testing to see, one, can the Neckslevel improve neck strength with the 8-week training program? And then the plan after that will be to look at head acceleration forces. Do they change after Neckslevel usage? And then, the step after that is like looking at, in use scenario, like, does it reduce the risk of concussion? So all that stuff takes a long time, and I can't say anything about it yet.
Right. But that's exciting stuff. And it's exciting that you're looking into the athletic realm. You mentioned too, soccer. I didn't even think about mentioning soccer before. Like, to me, when I think concussion, I think football automatically. But you're right. There's so many other sports like soccer out there that, these athletes get concussions, and then, maybe they're lucky and they, return and recover quickly. But I've seen concussions take, a month or even longer to get someone back to normalcy. And that month or so can look very different for people depending on your current state, at time of injury and all these other factors that we've discussed. So really putting the hammer down and getting this right from the start so we can hopefully reduce this. Like you said, studies are currently ongoing, but it sounds like things are a little bit promising so far. And I think too that the clientele that you're working with also speaks a little bit to the level that we're talking about here, pun intended, with Neckslevel. You're working with like tight ends on the Chicago Bears and other NFL teams. It's kind of hard to, beat that clientele as far as the level that you're working with. So I like to say, if they're using it, it probably works. I don't see professional sports teams shelling out money for things that don't work too often.
Well, thank you for the compliment. I've learned so much about, different little sports where you wouldn't necessarily think neck training is important or neck rehab is important, but it becomes brutally apparent once you talk to some of the athletes. For example, Formula One racing, where these guys are, whipping around in their high performance cars, the highest performing cars on the world, Formula One cars are. And so they're seeing like 4 or 5 Gs when their head whips around a turn. And so, the isometric strength of their neck is crucial. And so I had, one of the shining moments of my life now is getting to meet with one of the Formula One drivers last year during the COTA race, the Circuit of the Americas in Austin, Texas. And he got a couple Neckslevel, and, it's just been amazing. So Formula One has taken to it. And then professional bull riding, the PBR.
Really?
League.
That's awesome.
That's been cool.
That's incredible.
So, the bull riders, you obviously, it kind of makes sense from here now. They start with a real chin tuck, and as long as the bull rider can keep the chin tuck, the likelihood that they're going to stay on for their 8 or 9 seconds, whatever it is, the cutoff, is much higher. They've noticed that as soon as they lose the chin tuck, their head goes back, they lost it, then they're going to be off within a second or two. So in some way, keeping your head down, perhaps looking at the bull, keeping the spine aligned, keeping the core strong, whatever it is, that keeps them on the bull for much longer.
Interesting.
And then this one's kind of obvious, but grapplers, MMA, UFC fighters, they've loved it, and they love it specifically in prone, which is really interesting to me. But now, since doing jiu-jitsu, it makes a lot more sense. There's a weight-bearing component to their sport through their head. So they're going to be posting on their head. They're going to be putting their head on the mat and then using their hands up off the mat and manipulating their opponent in some way. So having their neck as another extremity is very useful. And so, of course, working the neck musculature in that crowd is quite obvious. And then recently I had a conversation with a NASCAR trainer, an IndyCar trainer. So NASCAR is different than F1 in that NASCAR, they're just whipping around a loop for a couple hours. So the demands on the neck are different than in Formula One. It's not something where the neck will fatigue out, where you'll hear, like I think it was Kevin Magnussen this year on Haas when he came back from it to start in Formula One again, his first or second race back. He commented after the race how tired his neck was. He said he fatigued out, which is a real problem, obviously. But then in NASCAR, this trainer said it's really not happening. That's not an issue. But he wanted a next level, and I was like, well, what makes this something you're interested in? He said, all concussion prevention, because no matter what, if you're in NASCAR racing, IndyCar racing, you're going to experience concussions. He was a driver himself, and that's why he had to retire. So he looks at it as like anything you can do to improve neck performance is going to mitigate the concussion magnitude when it does happen. Like how much can you slow down your head when you are in a collision? So it's just been really interesting how many different places people find value in neck strengthening, and it kind of speaks to this general interest in improving neck strength that has been kind of upswelling, and I think in our kind of athletic culture in the US.
Exactly. And, the other implications are pretty endless too. You mentioned a bunch of different sport populations. I was also thinking back to some of the patients I treated in the past who are horse jockeys, right? If you're stuck on a horse in that position for a long period of time, I would imagine that your neck stability plays a pretty key role in that. And I also think back to back in February, we published a podcast episode with Kelly Starrett, and Kelly just had this video. He went in one of the fighter jets, kind of like they used in the new Top Gun movie. And he was amazed at how physically fit you have to be in order to fly one of these fighter jets because of the G forces that you're undergoing, the speeds you're undergoing. And oh, by the way, you have to keep your neck and your body stable because otherwise you're whipping around all over the place, right? And naturally, we don't want that. But having worked, one of the clinics I was at was literally like 7 miles from one of the Air Force bases. Having worked with some of those people in the past and seeing them come in with whiplash and other injuries like that, to me, that seems like a huge potential for your next level product. And, for those listening, if you are in one of those patient populations, right? If you're someone who is in the service, if you're someone who is doing one of these different sports or activities, or really anything in life that demands a lot from your neck, go to your website's Neckslevel, and you have a clinic locator, I believe. You can literally find a place to go that has this device that we've been talking about.
You're a good salesman, guy. Can I hire you?
Make me an offer I can't refuse, right?
What the good news is, you're right. The clinic locator is helpful if you are a patient and you need to seek some care with a physical therapist that is using the Neckslevel. That's great. Have at it. The other thing that's cool is in the next, hopefully a couple months, 6 months or so, we'll have a consumer model. So something that is, within the affordable price range for someone who has neck pain, wants to treat it from home, perhaps doesn't have the time to go to a clinic, and we'll be able to coach them up on the right exercises to do. And then, like we said, start building from the ground up and rehabbing your neck from home. So I'm very excited about that. Ever since I launched this thing, there's a higher price point because, we're working with pro sports teams and clinics that have the budget to do so. And it's a new product, and that's kind of how the thing goes. And then the price can come down as your manufacturing improves and your processes become more efficient. But the whole time I've been getting like this chatter from consumers, like, I can't buy it, it's too expensive, I want one, blah, 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 blah. And I feel bad. Like, this is the audience that wants the device. These are the people who have that burning desire to use it. Yeah, the clinician's like, man, I would love to have one to treat my patients with it. But at the end of the day, they're not going home with neck pain. Like, the person who has it, the consumer, the patient, that's who wants the device. And I'm very excited to, within the next couple months, be able to offer them something. And I've been impressed by just, getting to know a couple of professional athletes. You become quite impressed by their daily habits. Some guys, like, they'll say, like, yeah, I'll just use the Neckslevel whenever I'm bored now, or every night when I'm stretching, I'll just jump on the Neckslevel for a couple minutes. And it's like, man, like, one, how great is it that as a professional athlete, you can just dedicate your time to helping your body in any way that you can, because that is the motor that is driving the paycheck. So it's just remarkable that, someone has the amount of focus, the desire to prevent injury, to rehab injury, and, in their free time, use one of your inventions. It's a pretty special feeling. But yeah, no, I mean, athletes are professional for a reason. They've beaten out thousands of other competitors that wanted it perhaps just as bad as them. So props to them.
For sure. And even applying it on the business sense, like you've said, you've kind of gotten into yourself, you can't grow and formulate a business without a few late nights and early mornings and long hours. And if you're not sleeping as good and you're spending a lot of time, in weird positions and postures and, burning the candle at both ends of the stick, for lack of a better way to put it, you're probably going to want to have a tool by your side that can help you manage those issues that might arise, because I would imagine you're probably a bit more productive if you're not in pain.
Surely. And again, man, I gotta hire you. You just keep bringing it back to the reason that everyone needs a Neckslevel. This is great. If you'd want to join the sales team, please consider.
Scott, for people listening, where can they find out more about you and Neckslevel and that sort of thing?
Yeah, so I'm on LinkedIn and Instagram. That's where I'm most active. And then all of our company handles are at Neckslevel, Neckslevel. And as you said, Dan, neckslevel.com is the website, and a consumer model is coming soon. So look out for that.
Awesome. Exciting stuff. Scott, really appreciate your time, man.
Thanks for having me.
Thank you for listening to this episode of the Brawn Body Health and Fitness Podcast. If you like this episode, please make sure you subscribe to the podcast on your favorite platform and share this episode with a friend who you think would enjoy hearing it. Additionally, if you want to help support this podcast and keep future episodes going, please check out our links below, where you can support us directly or through engaging in any of our affiliate marketing links. Last, please make sure you check us out on social media at Brawn Body, and leave a 5-star review, especially if you're listening on iTunes or Spotify.